Hi future nurses, if you've seen our videos before, welcome back. If you're new here, hello. I'm Abby, a registered nurse here at Blueprint Nursing. Today we're going to be taking a look at my personal clinical experiences within the nursing role. When you start your first job as a real deal registered nurse, you'll undergo orientation that will vary depending on and related to the unit or specialty you're working in. Personally, I completed a new grad residency program within the neonatal ICU that I was hired into. New grad residency programs are a relatively new concept that hospitals are implementing to help new grad nurses transition into their role. Every residency program will differ, but mine personally consisted of an in-depth orientation, education classes, and a final research project at the end of the residency. My orientation was a total of 12 weeks, but those 12 weeks were split into two segments, with each being 6 weeks long. The first segment was focused on orienting to level 2 NICU babies or lower acuity babies. These babies are typically feeder growers, which are infants that are learning to eat, grow, and are closer to going home. They typically have minimal oxygen support, usually no more than a nasal cannula or heated high flow oxygen, and typically require little to no IV access. I focused on these babies for 3 weeks on day shift and 3 weeks on night shift before I was brought off of orientation and able to care for them on my own. I worked on my own with level 2 babies for a period of time before it was time to return back to orientation for the remaining 6 weeks. During those next 6 weeks, I returned to orientation for 3 weeks on day shift and 3 weeks on night shift, but this time I oriented to higher acuity babies. This included infants with extremely low birth weight, severe prematurity, and respiratory needs ranging from CPAP to intubation with the use of an oscillator. On top of clinical shifts, my orientation also included lectures throughout the orientation period taught by members of the NICU healthcare team. Whether on or off orientation, when working as a real deal registered nurse, you'll be responsible for providing care to clients in a clinical setting. This will include performing regular and ongoing assessments, monitoring vital signs, and developing individualized care plans in collaboration with the healthcare team, clients, and their families. You'll also need to implement the plan of care, which can include administering medications, treatments, and carrying out any interventions ordered by the primary healthcare providers. You'll also be able to use the clinical environment to develop your clinical skills. If you're finishing up nursing school feeling like there's still skills to be mastered, don't be discouraged. You'll have plenty of opportunities to learn and grow your clinical skills. This can include IV insertion, wound care, catheterization, and using medical equipment. You'll also grow in your ability to critically think. Applying critical thinking and problem-solving skills is an essential part of the nursing process and helps you make informed decisions in complex and rapidly changing situations. That's a little bit about my clinical experience and what you can expect from the clinical environment when working as a real deal registered nurse. Thanks for taking the time to review this topic with me today. If you have any other topics you'd like to see discussed, leave them in a comment. Don't forget to check out our website for all of your NCLEX prep needs, and until next time, happy studying.